Hi everyone. Welcome back to Just What the Doctor Ordered. On this episode, we will be continuing our discussion of mindfulness meditation, both for people with glaucoma and people with any other conditions. In our previous episode, we had a guest speaker, Edmund Arroyo, who gave us an introduction about both mindfulness and meditation. In this episode, he will be doing a practice session with us so that we can learn how to use mindfulness meditation in our lives.
Okay, so when we think about mindfulness meditation, the first thing we need to get down is the proper way to breathe, which sounds kind of silly, right? We all breathe. But a lot of times we don't realize when we're really stressed out, we're not actually breathing properly. And if we want to have the most effect from a mindfulness meditation, we want to make sure that it incorporates some kind of healthy breathing. So the first thing I want you to think about is the idea that most things in life, whether it's weight gain, diabetes, heart disease, all these medical problems that accumulate over time often have simple solutions in that we need to watch what we eat, we need to move more, we need to not eat so much sugar. There are simple explanations for how to fix these things or address them or prevent them. Well, the same thing with some of the other challenges that we have, especially with anxiety and tension and how we carry that in our body. And we got to understand that disease is kind of correlated with tension, right? So when we think about, or restriction, I should say. So when we're talking about when it comes to the eye, for example, how it makes perfect sense how if we can relax and not have so much restriction in our body, then we actually can increase blood flow to different parts of our body. So let's talk about that now. Let's talk about breathing, okay? So with breathing, I want you to practice first. Make sure that you're in an upright position, and I want to make sure that when you breathe, you breathe with your whole abdomen. A lot of times when people are stressed out, they take a deep breath and they go like this. Okay, they're just basically raising their shoulders while they take a deep breath. What I want you to do is I want you to breathe with your whole abdomen. Watch this. So you'll see my chest will raise and my stomach, because the least restrictive way of breathing is actually with your stomach. And if you're laying down and you're sleeping and you're breathing without thinking about it, which is what happens when you're sleeping, then your stomach actually will just go up and down. Your chest will barely move. But when we're awake and we're stressed out and we have all these things to think about in our life, we start tensing our body. And the example I give people sometimes is, for example, if I was going to punch you in the stomach, if I said, okay, here I go, I'm going to give you my best shot, I'm going to punch you in the stomach. What you would do is you would tense up your abdomen, you tense up your chest, you tense up your abdomen like you're getting ready to take on some kind of impact. And what we don't realize is that as you carry stress throughout your day, throughout your weeks, throughout your year, we tense our bodies and we become rigid. And so we don't ever fully allow ourselves to take deep breaths and relax. And this is why a lot of people have trouble sleeping at night. If you think about a yawn is something that people do when their body automatically does to try to get them to fall asleep because it recognizes they're tired or it's trying to gain more oxygen because we're not breathing properly. So sometimes at night, people's minds are going. They can't stop thinking about the next thing they need to do tomorrow. They want to forget this and they can't relax. And so this actually could help you in your sleep, which maybe I can cover at a later time. So let's go back to the breathing one more time. Everybody practice this deep breath. You can breathe in your nose, out your mouth, in your mouth, out your mouth. That's fine. Whatever the least, whatever allows you to get the most air. So that's just a basic concept of breathing. Now, for the simplest of meditations, if you simply do that, if you could just do that 20 times a day and just focus for those 3 seconds in, hold it for a second, out, and do that throughout your day, that alone will have an impact on your health and your mental health. But if we want to talk about a full meditation, I'm going to give you 2 simple meditations that you can do, and I'm going to show you how you walk through them. There are a lot of apps out there, by the way, that can walk you through meditations, but if you don't want to listen to the app, if you're just in your car, you have 2 minutes, you could do both of these meditations where it's just a matter of bringing you, remember, mindfulness is bringing you to this moment and focusing on one simple activity to calm your mind and calm your body. There's a lot of research how if you can regularly incorporate this in your day, it has an impact on your, not just your body, but also your brain. Changes your brain. So the very first one I'll teach you is using the senses. So we'll start with the sense of sound. So throughout your day, you're walking in work, you're sitting in your house, there are all these sounds that are going on around you, but you're simply not aware of most of them unless they're out of the ordinary. For example, if you're in your office and you hear a dog bark, you're going to notice that. But there are also 100 other sounds that happen in that last 20 minutes that you just filtered out because it was insignificant. So what you could do for one simple mindfulness activity is you can start with a deep breath. And then what you'll do, we're going to do right now, is you just remain silent for about a minute. And I want you to think about, or not think about, I want you to pay attention to anything that you hear in that 1 minute, right? I'm going to do it for 15 seconds. Here we go, deep breath. You can close your eyes if it helps you focus on your hearing. Making sure that you're maintaining your breathing throughout. Okay, in that 15 seconds or so, I heard, which I didn't hear before, my son typing in the other room. I heard the wall creak. I heard the furnace make a noise, some kind of the vent or something like that. Now that's all been going on, but I haven't been focusing on that. That's something that you can do for a full minute. The better you get at it, 5 minutes, 10 minutes. And here's the key. As you're doing that, thoughts will enter your mind. The important thing is you just notice them and let them float by. The example that we'll give in meditation is like a river with leaves flowing through it. You would just notice the leaves and then you just let them float by and then notice the next leaf and let it float by. But you maybe focus on the water, right? Leaves will just come and come and come down the river because there's all these trees that line it. You wouldn't focus your attention on one of those leaves. Like, oh, look, there's a leaf. It's got a spot. And it's this. You wouldn't do that. So we don't need to do that with our thoughts. And we got to be able to free ourselves of our thoughts just for a few minutes throughout our days. So that's one simple activity, and you focus on the sounds you're hearing, and what you'll notice is you'll start to get actually better at hearing the things that are going on around you. You become more in the moment. You become more observant, which is the whole purpose of mindfulness. Bring you to the moment so you're not stressed out about the future, that you're not regretting all the things in the past, and then it doesn't have this effect on your body, or inflammation, tension, restriction, which we've talked about. The second one I want to do, the second mindfulness activity that I want to do, it's called color breathing. So this involves the imagination part of your brain. And so sometimes, again, focusing on one little activity can help. So what you'll do is you imagine you take deep breaths. And with each deep breath, you imagine breathing in a color that you view as beautiful or clean. It could be green or pink or yellow, whatever you associate with that color, or whatever color you associate with that feeling or that thing. And I want you to imagine a color that you maybe consider dark or ugly. It could be like maybe purple or maroon or something like that. And so what you'll do is you'll close your eyes and you'll start by imagining all around you. I want you to imagine that beautiful green, clean color. And I want you to imagine inside of you a color of waste, or a color of ugliness or darkness or filth that we want to purify from our bodies, right? This is part of life. We do that when we breathe out anyway. And also, other ways that we release, toxins from our body, and these kind of things. So I want you to imagine that when you're breathing. So what we'll do is we're going to take a deep breath. With the first breath, I want you to imagine breathing in this beautiful color around you. Imagine it going in your nose or your mouth, through your throat, and filling up your lungs. And then when you breathe out, I want you to imagine breathing out that dark color out into the world and imagine it dissipating. And then our second deep breath, we're going to breathe in our nose, and we're going to go to our knees, and imagine the air going to our knees and our elbows. And then we're going to imagine pulling all the bad stuff out of our nose, out of our mouth, and out into the world, and dissipating it in that dark color. And then our last breath, we're going to take a deep breath, and we're going to breathe it all in again, the good bright color, down in through our lungs, all the way to our extremities of our hands and our feet. And then we're going to bring it back out, coming out of our body, back out into the world, all the ugliness, tension, and whatever bad feelings and mojo you got going on inside, okay? So first breath, everybody relax, upright position, deep breath. Hold it for a second. Imagine your lungs filling up with a bright, clean air, and out into the world, ugly, darkness, the garbage from within us. Deep breath in, all the way to our elbows. Hold for a second, all that clean, beautiful air, and out into the world. Now imagine the room surrounding you. You can breathe normally right now while I'm talking. Everything around you, all the beautiful, clean air. And we're going to breathe it in through our nose, into our lungs, really deep, all the way to our extremities. One last time. And out into the world. Okay? That's a simple 1-minute mindfulness meditation you can do. You can do it longer. You can do it for 5 minutes, 10 minutes, 20 minutes, but it's not necessary. Now, one of the things I want you to think about in closing is that a lot of people are out there smoking. A lot of people are out there, using drugs, using these vapes that are coming out right now. And people will say things. I remember they always used to say that smoking calmed them. And I want you to think about that for a minute, because smoking has nicotine, which is a stimulant. So physiologically, it's not calming them. Actually, what it's doing is sometimes they're holding their breath all day until they get that cigarette. And when they finally get that cigarette, they get it out. They're actually holding their breath in the process. They light the cigarette. They light it, and then they take a deep breath. We've all seen that. We've all seen somebody expand their lungs to take a deep breath, the drag of their cigarette, and that may be the first deep breath they took all day. And so if we can incorporate this into our life through meditation, through mindfulness, then we don't need to rely on something like that, and actually have a healthier alternative to releasing the tension, releasing the restrictions in our body, and overall living a much healthier, peaceful, less stressful life. Thank you.